Okay, so to make things easier for all these pathways, I'm gonna have something here. So we have common pathway in which we have the 1, factor 1, factor 2, factor 5, factor 10, and from factor 10 we're looking at factor 7 as a extrinsic pathway. And for intrinsic we said 8, 9, 10 is already there, 11 and 12. Okay, so this is the common pathway. Common. This over there, it's the extrinsic pathway. And here is all the intrinsic pathway. Intrinsic pathway. Intrinsic pathway, we know that subendothelial collagen stimulates intrinsic. Three wordings, words, or 3 alphabets. We are looking at how do we check if the intrinsic pathway is working. PTT. And extrinsic pathway is stimulated by tissue thromboplastid, and that's going to stimulate your factor 7. TT, how can we check the extrinsic factor if they're working or not? PT, 2 alphabets, 2 alphabets. Extrinsic PT, the mnemonic is PT, play tennis. Play tennis. Where do you play tennis? Outside or inside? Outside. So play tennis outside. Right? Play tennis outside. So extrinsic, meaning outside. Play tennis outside. Play tennis. Play tennis is extrinsic. And the war is also outside, right? War is also outside. And Warfarin. For Warfarin we also check PT. And Hep. Intrinsic PTT. Play table tennis. Table tennis is always inside. So play table tennis, that's an intrinsic. Check. We give heparin, and heparin can be checked by PTT. And why 3 letters here and only 2 letters there? 2 alphabets there and 3 alphabets here, because they look at the numbers. So many numbers here. That's why I guess the more number. And only 1 number there on the extrinsic pathway. Okay. Now factor 2 is called prothrombin, which will be converted into thrombin. Factor 1 is called fibrinogen, which will be converted into fibrin. That's all for the coagulation cascade.